Joe. He has just moved to Gratiot County from out of state and has learned that it is widely known that Gratiot Family Practice is the premier practice in mid-Michigan. He has heard that the providers at Gratiot Family Practice are easy to get into and are kind, caring, and knowledgeable. But what makes Gratiot Family Practice stand apart is a team approach called the Patient-Centered Medical Home. Joe is excited to learn more about this and become a patient at Gratiot Family Practice, so he calls for an appointment.
Good morning. This is Crystal at Gratiot Family Practice. How may I help you?
Hi, this is Joe. I just moved here from out of state. I'm a diabetic and I need to see someone to help manage my diabetes because my last blood test was too high. You know, the 3-month sugar check?
Yes, Joe. You mean the hemoglobin A1C? I would be glad to help you get an appointment. First of all, how would you like to be addressed?
Oh, Joe is fine.
I will make a note of that in your record. Would you like to make an appointment now or use our easy access internet site?
I would like to make an appointment now if I can.
Sure. When would you like to come in?
Well, I'm kind of nervous about this sugar thing, so the sooner the better.
I understand your concern. We could see you today at 2 if you're available. You will need to allow some extra time to meet our team and give us some background information. You should plan on being here about an hour and a half total. Does this work for you?
Yes, that would be great. Hi, I'm Joe. I have an appointment today at 2.
Yes, we are expecting you. I am Crystal, and I was the one who talked to you on the phone earlier. I have the opportunity today to be your patient representative.
I am not familiar with the term patient representative. What exactly does a patient representative do?
Joe, I am glad you asked that question. It is the representative's job to introduce you to Gratiot Family Practice and coordinate your care. At any time, you can contact me or one of our other representatives with any questions or needs you might have. Our other responsibilities are helping you understand how the healthcare at Gratiot Family Practice is delivered, how we strive to function as a team, and what the patient-centered medical home concept is. Going over our brochure with you that has our mission statement, explains the patient Gratiot Family Practice contract, and gives you the basic information about our practice, such as office hours and our after-hour policies. By the way, we are open late on Wednesday nights for your convenience, providing you legal and confidentiality information called HIPAA. Letting you know the ways in which you may communicate with our health center and team members, obtaining your picture and identification information for our records and giving you any assistance you may need with the check-in process, making certain that any healthcare records that need to be transferred or received are processed correctly. You schedule appointments and enroll you into group visits or chronic care programs that will be available to you. Help maintain and use our patient registries, which are the lists we use to identify groups of patients with similar conditions, such as your diabetes. Through these registries, we proactively help you manage your condition to help you stay healthy. Let's go on that tour now and meet some of our team members.
This room says patient education. What happens in here?
Joe, these are our nurse educators. Now, although all of our nurses participate in the education of our patients, they are responsible for special projects and the main displays you see around the office. They also will give more intensive education on specific topics, for example, insulin training for diabetics. They are also available for questions through their nurse educator email addresses. They are knowledgeable on resources in the community that you can take advantage of. They also will call you after you have been hospitalized to check on you and make sure you are doing okay. This is a relatively new position in our office, and we are proud of the way they are learning about the various ways they can be of use to our patients.
So I was curious, how do I receive my test results?
I am glad you asked that. We do not think that the no news is good news policy is acceptable. You will always receive the results of your tests whether they are normal or not. This may happen in many different ways. You may receive a phone call, an email, or a letter in the mail. You may receive a notice that your provider has dictated a message for you. You will then call a number and using your personal PIN, access that message. You also may get a reminder message to schedule a test that is due or to encourage you to get one that you have forgotten to do. Finally, you can go to the internet and through our secure patient portal, access your test results and your charts directly. We also will track any referrals we have made to specialists on your behalf to make sure we get correspondence back from them. This way, we can always stay in the loop. In here is our billing department. Dawn is the backbone of our practice and is an expert at dealing with insurance companies. Yet she is understanding and compassionate as she helps our patients deal with the complexities of their medical bills. Don't let her mild-mannered appearance fool you. When she is instructing the providers on our many billing mistakes, she can be quite the lion.
Okay, I think I get it. But what if I feel more comfortable with one provider more than another?
We'll try and meet your request as best as we can. Because our providers try and give you as much time as you need at every visit, they can't see as many patients every day as some would like. However, the more efficient our practice becomes, the more free time the providers will have for direct patient care.
So what is the mission statement of Gratiot Family Practice?
I believe our job is to help people live better lives so they can reach their full potential.
That sounds really good.
Let me help you with the rest of the check-in process, and then we will get you in to see the doctor. When you are done today, you will have the opportunity to fill out a survey telling us what you think of your visit today and offer suggestions for improvement. It has been a pleasure to be able to serve you, Joe.
I'm a new soul, I came to this strange world hoping I could learn a bit about how to give and take. But since I